What is small fiber neuropathy? Technically speaking, and according to Cleveland Clinic, small fiber neuropathy, or SFN, is a form of peripheral neuropathy. It impacts your central nervous system. It happens when something damages small nerve fibers in your skin, causing symptoms like painful tingling or burning sensations in your hands and feet. The condition also can affect other small nerve fibers that manage essential body functions like your blood pressure and heart rate. SFN symptoms can be severe and affect your overall quality of life. I suspect my journey started after I had the 4 major abdominal surgeries. Physical trauma, COVID, and some very strong antibiotics have been linked to this autoimmune response. But neurologists say peripheral neuropathy has 4 causes: chemotherapy, diabetes, alcoholism, and idiopathic, which means unknown. The first thing I noticed is my skin was changing. My feet, legs, hands, arms, and face were tingling and topographically changing. My feet would turn stark purple or stark white in reaction to temperature. The tingling turned into burning fiery ants, numbness, all over pain, lethargy, weakness, dry mouth and eyes, brain fog, inability to articulate, and making mistakes I never would have before this disease. I had to go on FMLA several times and eventually completely on long-term disability through my work. That in and of itself is stressful and not guaranteed, and to be saved for another video. SFN began affecting my autonomic system, resulting in dysautonomia, episodes of extremely rapid heart rate, extreme sweating, and labored breathing multiple times a day. I take medicine for high blood pressure that keeps my blood pressure at an acceptable rate. However, my resting heart rate average at this point in time is 105 beats per minute. That's high. My gastrointestinal symptoms began to increase, leading to gastroparesis or low motility. The result is that I cannot have regular bowel movements. I've gone almost 2 weeks without a BM. Essentially, the longer the time between BMs, the more likely that I'm going to vomit and feel sick. Postural orthostatic tachycardia syndrome, or POTS, is another issue that I face. I didn't know what that was to begin with, but now I know that when I stand up, especially when in an episode, my blood pressure significantly drops, resulting in dizziness and instability on my feet. I have fainted about 10 times in the past 4 or 5 years. Even with being situationally aware and very careful, I still fall about once a month. The takeaway from this video is don't ignore symptoms. Document and see your primary care physician and request an appointment with the correct specialist. Unless your SFN was caused by one of the 4 major reasons listed by doctors, you may fall into idiopathic and drive yourself crazy trying to determine what caused this to happen to you. Even though you may not discover what is causing your SFN, please research and educate yourself and cross-check what you found out with your clinical team, or at a minimum, a support network. Thank you for listening. Check out my other videos.